Maribel, welcome to the podcast. Thank you so much for being here today.
Thank you for having me. This is such an amazing space to be able to talk about some really interesting things.
Yes, we're definitely going to have a very interesting conversation today, and I'm really excited to learn more about you and your story. But before we even get there, I always have every guest who comes on briefly introduce themselves to people who are meeting you for the first time. So let them know, who is Maribel, aka the Queen of Trips?
So, I am a Miami born Colombian American. I was raised in the 80s in Miami, first gen. So, I'm actually the oldest first kid born in the United States in my entire family. My cousins and my sister kind of look up to me as kind of like the leader of the family. I am a very loving daughter, very dedicated to my family, happily single, entrepreneur, side hustler, like hoping to move into the blogging space very soon as well.
I love that for you so much. And we're definitely going to talk about your entrepreneur journey with the Queen of Trips. I want to know more about that. But before we even go there, I do want to put a trigger warning for anyone who may be listening. We are going to talk about cancer today. Maribel is a breast cancer survivor. And first and foremost, I'm just really, really grateful to you for being able to have the strength and courage to talk about something that, like we said before we even start recording, this is very taboo. I think a lot of people get uncomfortable around just hearing the word cancer. And for you to be a survivor and for you to be here to share your story, I just want to give you your flowers because I know it's not easy to talk about, but I'm really, really grateful to have you here today.
Thank you. And so actually that's one of the things in my cancer journey. I am very interested in talking about these topics because unfortunately the statistic is that 1 in every 8 women will be diagnosed with breast cancer at some point in their lives. And so for
Wow.
many of us, it may be a sister, a mom, ourselves, a friend, a cousin, somebody that we hold very dear to our hearts. And many people avoid anything that has to do about cancer, or it's something that we don't even consider as a possibility that it may happen to us. And yet, surprise, it happens to so many people.
Yeah, a lot of people probably don't know from my podcast, but my mom was actually a two times breast cancer survivor. She was diagnosed the first time in Thanksgiving
Oh my gosh.
weekend of 2017. I will never forget. We'll go into that as the conversation progresses. And then she was diagnosed again in March of 21. So it's been a journey. And I couldn't even imagine, being the survivor going through something like that. And not just breast cancer, any type of cancer. I'm curious, did that run in your family? Because for me, there's no one who had breast cancer. Like, this was my mom's side of the family. Her father passed away from stomach cancer. We have diabetes and all of those types of things. But when it came to breast cancer, she was the first person. And I'm like, holy shit, that's my mom. So, like, it could possibly be passed on to either me or my sister. So I'm curious to know, for you, what was it like in your like family history when it comes to cancer?
So, to be honest, every single person that has passed in my family has passed from some sort of cancer. And as part of my treatment, when we first discovered that I was positive for breast cancer, one of the first things that they had us do was do a genetic testing. So I had to sit and do my family tree. So basically, on both of my parents' side, both of my grandparents had some sort of cancer. So on my dad's side, it was brain cancer, and my grandpa, who passed away last year, had leukemia. On my mom's side, it was leukemia for my grandpa and stomach/slash colon cancer for my grandma. And then from there, some of my uncles had passed away due to pancreatic cancer. I had it on my dad's side that passed away last October. She had bone cancer. I have a aunt right now going through. But the interesting thing is that during the genetic testing, allegedly, as of the testing that they have access to today, we allegedly do not have any predisposition to genetically developing cancer. So that goes to show that it's mostly in our situation, it's environmental slash all of the other factors that they consider, which is stress, maybe a poor lifestyle, bad eating habits, not exercising enough, consuming too much alcohol, because now there's like direct links that alcohol consumption can help your body develop these cancer cells, especially breast cancer.
Really? Wow.
Hmm.
As being a family member of someone who has dealt with cancer, we definitely have done research, and a lot of the things that we saw was because of your environment, which is so scary, right? But
Hmm.
again, there is a genetic role that plays in it. But thank you for sharing that, because this is also going to be very educational for people who are ignorant to this topic. So I appreciate you bringing some stats and facts. So, let's talk about now your actual cancer diagnosis. I would love for you to talk about when you were diagnosed, how old you were, the feelings, anything that you feel comfortable with talking about. Take us on that journey before you started treatment.
Absolutely. So at the time, I had a boyfriend. We were living together. And as normal for when you're a couple and you don't want children, I was out of birth control pills, called my doctor up for a prescription. Luckily, she said, let's have an exam before we reissue your prescription. I was a little annoyed because I had recently seen her. So, anyway, luckily, it was kind of like destiny for me to go in for an appointment that day. So I went through my regular checkup. And luckily, this is a doctor that does the tactile test on your breasts. And she felt a lump that I had not felt. And to be honest, I wasn't really a consistent person in checking myself, which, by the way, before I even move on, I want to encourage everybody, and I'll say it maybe multiple times during this podcast, but schedule yourself for a self checkup every month, like the first of the month. And you'll typically see like breast cancer survivors talking about it on social media, but always like schedule yourself. And this should be part of your like self-care routine, because if you love yourself, you're going to do everything and whatever you can control to make sure that your body's okay. So schedule yourself that self breast exam. But anyway, I wasn't doing it. And so she found this lump. I had never felt it before, and I still brushed it off. She gives me a prescription for an ultrasound. This was a Monday at like 9 a.m. It was October 2018. I was 38 years old. So those things are so like,
You'll get to it when you get to it.
right. But like I said, so destiny, or call it what you may. My sister, she was a CT scan tech at a hospital here in South Florida. Her daily job is finding cancer cells and all kinds of other issues that people may have. She does CAT scans with contrast. So I sent her a picture of the prescription, and I'm thinking I'm just going to Costco right after this appointment, and I'm not thinking anything of it. My sister called me back in 2 seconds, and she's like, "Who gave you this?" So I told her the situation. She did anything and everything possible to get me on the schedule that day. I'm still very oblivious. I'm like, oh, this is nothing. It'll just be another extra little exam and that's it. I go to the hospital because she got me an appointment within 30 minutes. She's like, we don't play around with this. You need to come to the hospital now. I get there. They start asking me all of these questions. I had the ultrasound and I noticed that the tech is like going over and over and over this area, starting to get a little concerned. Then they say I'm okay to be approved for a mammogram from my insurance company because I was close enough to being 40 that they would approve it. So they did. And I was scheduled for a mammogram the same day. My sister, mind you, is in the room with me as all of this is happening because, to make matters worse, I have a immense fear of needles and anything that has to do with doctors, but it's beyond a normal fear. It's not anxiety, it is unrational fear of being prodded and poked with needles and anything that has to do with medical stuff.
Was that prior to this whole situation?
My entire life.
Yeah.
So in Colombia, we used to have vaccination campaigns that were obligatory. And so they used to have to hold me down for me to get a vaccine.
Wow.
But I digress.
I mean, it's a real fear that a lot of people experience. So, yeah.
It's so horrible. And it's very hard to seek treatment when you have this fear. A lot of people that have this fear end up finding too late that they have health issues. So anyway, my sister was helping me with my anxiety throughout this entire day. They do the mammogram. And when they pressed my left breast, I almost passed out. because a mammogram is very uncomfortable for women. And by the way, please do not let this stop you from getting one if you ever have to.
Listen, we have real talk on this conversation.
Right.
So we talk about the shit I say all the time that people don't want to talk about, but we need to talk about it.
Exactly. And it's uncomfortable, yes, but please do not ever let anything like that stop you from doing what you need to do to make sure that you're going to be okay. And I think that's kind of like the recurring theme in what our conversation will be like today, because
Mhm.
fear can really stop you from so many things. And do not let fear hold you back from seeking health, doing the things you want to do anyway. So mammogram happens, I almost pass out. And then like 30 minutes later, doctor comes in and she says, we need to do a biopsy. And then my world starts crashing down on me, because for somebody that has this fear, like one of the worst things that you can be told is that you need a biopsy, especially of the breast. It's very invasive. There's other underlying issues in my life where I have this thing about getting injected. And it's very tough. It is a very tough situation to go through. I end up telling them that if they don't schedule me for this biopsy on the same day, that I may not have the guts to come back and do this. If I am given too much of an opportunity to think things through, like too much analysis produces paralysis. And so if I sit there and overanalyze something, it may stop me from doing it. I don't know how, but they scheduled me for the biopsy the same day. So I spent the whole day at the hospital. That was super unreal, like a very unreal experience. I was outside of my body. After they say I need a biopsy, I am at a point where like things are happening and I'm no longer present in this body anymore. Like it was an out of body experience. I can't even explain it. So after that, they send it in for testing. Morning comes and goes, and then things start getting real, because typically if it's negative for cancer, like they can typically find that out very quickly. And by the way, nobody should expect results this soon. I don't know how things happen so soon. I mean, I do, but I think my sister being an employee of the hospital helped me a lot. But typically test results take sometimes 3 to 5 business days, and you're there like,
Shit, sometimes it takes like up to 2 weeks. I used to work in the medical field, and when it comes to like cancer diagnosis, it takes a while for that to come back.
yes. So it's now the afternoon. I'm trying to pretend things are okay, sending my little stupid emails at work, faking it like nothing's bad, like nothing's going on. And then I see it's like 3 o'clock and my sister walks through the door at my house, and I'm like, ah, shit, this is it. And then 5 minutes later, my ex-boyfriend comes in and I'm like, oh, fuck, just tell me I have fucking cancer, right? And she looks at me, and then she couldn't even hold back her tears, and I just explode in tears. And it is a very emotional moment. And obviously it's very hard for her to deliver this news to me. I think that the doctors allowed her to, because we had had all of these conversations the day before about my anxieties and all that.
Right.
So,
Yeah, for anyone listening, that's not a normal circumstance because that's a HIPAA violation.
mhm.
But being that you had connections inside, it makes total sense. And emotionally, I don't think you would have been able to handle hearing that from
In an
anyone but
office.
her. Yeah.
Right. And I also told them I signed anything and everything that needed to be signed for my sister to be fully involved in my cancer treatment, and for her to help me guide me through decisions that I needed to make.
Do you mind sharing? Because I know for breast cancer, there's different stages. Do you mind sharing what diagnosis yours was?
So mine was called intraductal carcinoma, which is in the milk ducts inside the breast. And I was stage 2B to 3. I was kind of in between stages. 3 is when they can already see it in your lymph nodes. It hasn't started to travel. So typically there's 4 stages with cancer, or 5, because sometimes they'll consider 0, which are previvors. And for anybody that doesn't know what this terminology is, a previvor is somebody that has the BRCA gene. So there's a gene actually that can tell you whether or not you have a predisposition to get cancer. There's certain groups of people, like if you're descendant from Ashkenazi Jewish people, it is known that you already carry this gene, like it's a given. They will still run BRCA testing and all that. But for the rest of people, like that's one of the reasons why they do genetic testing, is because you may have this gene and it can predispose your body to create breast cancer and ovarian cancer, and sometimes both. So it's either or both. So that's a very important test to get after you've been diagnosed with cancer. Or if somebody in like a mother or grandmother, aunt has breast cancer, the insurance companies will possibly cover you for BRCA gene testing.
Let's stop right there because that's a lot. You just talked about getting the diagnosis. And as I'm listening to your story, I'm just thinking back of my mom's experience the
Hmm.
first time, right? And hers was stage one, I think. It
Hmm.
was caught very early. And they had to do the biopsy as well. They had to take out a few lymph nodes. And I just remember from being an outsider, like my first thought was like, oh my God, I'm going to lose my mom. That is the first thought that I had. So I'm curious to know, like, what was your mindset like when you first got that diagnosis?
So I get goosebumps to this day because your first reaction, and maybe your mom can also attest to this, but because there's so little that the public actually knows about cancer, let's start off with the fact that cancer is like 400 to 500 different diseases all lumped into one denomination, I guess. There's like so many varieties of cancer. So when you hear you have cancer, for me, I thought I was going to die like next week. That was the first thing. I think I wrote this in one of my posts on Instagram one time. It was like this feeling of, oh shit, I got diagnosed with this deadly disease and I didn't fucking live my life how I wanted to live it. Like I didn't get to do so many things. And again, when you first get those words, you have cancer, it's kind of like those movies, when everything else is like rushing around you and you see, but you're just standing there like in complete disbelief. Like this could never happen to you, especially at 38. And I'm sure for even older people, it's the same experience because it's just something we don't ever think about, like we're going to get.
It's like when you see the things on the news of like the school shootings or like someone got killed, it's like, damn, it's horrible for them, but I don't think it could ever happen to me or someone that I know. And then when it does, that shit hits different.
Yes. It takes like 2 weeks before you understand, like, what the fuck just happened? Because between the testing, and there's so much testing after cancer. So, like, once you get the diagnosis, unlucky for me, or luckily, depending on how you look at it, after the initial biopsy and all that, I then have to have a CAT scan with contrast, which is now my sister's department. I go to get a CAT scan with contrast, and then we get the results, and they find more calcifications in my right breast. So then that requires an additional biopsy. And so here we go again through something that I already know is painful, that I can't fathom have to go through another biopsy again. And because as they go testing and as they find additional things, you have to get biopsies. So like if they found the first tumor during the ultrasound, then they have to do an ultrasound biopsy, which is what I ended up having. In this case, they found the other calcifications during an MRI. So that's a different type of test. So for the MRI biopsy, you're in the machine. You are on your belly on this surface, which is not comfortable because it has to separate your thorax and your abdomen from your stomach. And it's very uncomfortable. You're there for a certain amount of time, like 30 to 45 minutes. The doctor is under the machine trying to get a sample as the machine is pressing your breast. It's very painful. And I had a bruise from the machine pressing my breast that lasted like 2 or 3 weeks, and it turned all kinds of colors. I cursed a lot. The radiologist that did that test is also Colombian. And my first word as soon as she injected me was, ay, hueputa.
I'm sure they've heard every word that you could think of. Yeah.
Oh, girl, that Colombian word just, oof,
Yeah.
it just rolled out and the doctor laughed and oh my gosh. But that was another super painful thing to get through and very anxiety inducing. And I ended up taking 4 pills that they give you, like they're supposed to give you just one. I had 4. I was still on edge. The anxiety level is huge. It doesn't really help much, but we get over that. And luckily they were benign. So again, there's tons of testing. So they also test for something, I think it's a protein called HER2. So depending on whether it's positive or negative, whether your cancer is hormone positive and or negative, then they determine different cancer treatments. There's like 8 different treatments, and don't like quote me to the T on this, but there's multiple cancer treatments that you can go through depending on the varieties, depending on your stage, depending on whether or not it's HER2 positive or negative, and progesterone and estrogen positive or negative. So I end up having 8 chemo sessions plus a year of a drug. Mine was HER2 positive. So there's 2 drugs that are used in combination. They're called Herceptin and Perjeta, and they're mild. They're not terrible to deal with, but the chemo is a bitch. The chemo is a bitch. And for anybody that is recently diagnosed and is listening to this, there will be some really tough fucking days, and some days that you just want to give up. I went through some really, really dark moments, and I may tear up a
Yeah,
little bit.
please. I feel it coming too. Listen, I told you before we started recording, any emotion that comes up is welcomed here. This is a real ass conversation, and I'm so proud of you. So take all the time you need.
So there's a buildup, right? Your first chemo is never easy because you don't know what to expect. You have all of this anxiety and anticipation. It's not, obviously, you're like, you hear, oh my gosh, the amount of people that want to give you unsolicited advice about what you should do is insane. So the way I took it was, all of these people are trying their best with what they don't know. I tried to give them grace. Sometimes people can be out of line, but I know it's, for the most part, it came from people having their heart in the right place, right?
Right. It didn't come from a malicious place.
Right. You get just so much. Like, some people will say, don't do chemo, it's going to kill you. And it just adds so much to this stress that you're
Already dealing with.
right. Anyway, the first day of my chemo, I have the worst headache. It's a splitting headache, and it's mostly from the anxiety, I know. And of course, medication that I've never had in my body before. It is very heavy medication. So I remember still going through those appointments, like the preparation before the chemo. And I'm still thinking that somebody made a mistake down the line. And by the way, I've sent this to 3 different doctors to make sure that I really did have cancer. And
Yeah.
I didn't believe any of them.
My mom did the same thing. She went to like multiple doctors to get a second opinion because you never want to trust the first one, especially when it comes to something like cancer. Like, let's make sure this is really what it is before we dive deep. So it makes
Right.
total sense.
Also, I kind of get like tidbits.
No, please do.
If you're dealing with a doctor, and there's so much in this conversation, honestly, because a lot of women are dismissed for years about their pain, about
Medical gaslighting is a real thing. Dr. Phil did a whole fucking episode about it. And the amount of women, especially, who are literally gaslit out of these symptoms that they're feeling until it's too fucking late. It's a real thing. So I'm so glad you're bringing that up.
right. So for anybody that has some suspicion, like, go change doctors. If your doctor's not listening to your needs, luckily that wasn't my case. But that doesn't mean that it doesn't happen to thousands of women. It's not just a few cases here and there. There's so many women in the cancer community, especially when it comes to like ovarian cancer. Because one thing about breast cancer is, the majority of people, it's very insidious. You don't really feel it until shit's like really bad. But there's other cancers that are where people end up gaslit. And for the most part, that's like ovarian cancer, some pancreatic cancer. If you're feeling something that doesn't feel right and your doctor's not paying attention to you, go find another doctor, because it's some bullshit.
It could
Like,
be a life or death situation.
exactly, exactly. And so I'm still not believing that this is my life. I kind of bargained with my doctors. I'm gung ho on trips. Like, I'm very much about traveling. And I had a business trip. Like, right after I was diagnosed, I left for a week on a business trip to London and Paris. And I had some time to sit there with myself with my diagnosis. And I cried it out for a bit, but had to get back to reality. And I went through 8 chemo sessions. The third one, I think by then my body was exhausted. You lose your hair 2 weeks after the first one is when you typically lose your hair. I didn't believe it was going to happen to me. For some reason, I thought I was just like out of the norm. I actually did prepare for it. I did short hair, dyed it pink, took the pictures, had my sister and my sisters from another mister with me. And we just kind of like navigated this together. So I really had like a good support system in my friends and my family. And it's the third chemotherapy session. And I felt like Voldemort. I had no eyebrows, no eyelashes. I felt hideous. My skin is clammy as hell. I was looking gray. I wasn't sleeping right because there's this feeling after chemo, like you can literally feel the cells in your body going berserk. And then 24 hours after chemo, you get a shot called Neulasta, which, by the way, healthcare industry in the United States, y'all on some fucking shit with the price of this drug.
Girl, insurance companies, that's a whole nother conversation. That's a whole
So
fucking scam.
this shot is anywhere between $10,000 to $15,000 per shot.
Jesus Christ.
And you need one 24 hours after your chemo because the sole purpose of this shot is to help your body create trillions of white blood cells to replace the white blood cells that chemo is killing off. Because the thing with chemo is it's not smart enough to know which ones are cancer cells and which ones aren't. So typically it'll attack any soft tissue, which is why chemo patients have typically sensation of burnt tongues. You have burning pain in your vagina because it's a very soft tissue. Your bladder is very much affected. Your kidneys are affected. And so even you feel inside your nose a burning sensation. So chemo is just really, really
Intense. It sounds horrible.
like your taste buds change. For the longest time, water tasted like it had pepper in it to me, like black pepper. The smell situation is so intense that if somebody's cutting onions or if you're in a restaurant, like I literally would have to walk out of restaurants because I couldn't stand the smell. It was very powerful. As if things are going great during my third chemo, my body decides that it's a great time to have a boil. And then it's very dangerous because you can die of sepsis during chemotherapy treatment because again, your body's just everything is an extreme. So like even if you cut yourself, you have to make sure that you don't get MRSA. Like any little thing, even if you think it's insignificant, it's very important to be in constant communication with your doctor. So again, very important to have a doctor that listens to you, that pays attention to everything, your needs, that does not gaslight you or diminish what you're trying to express to them. So anyway, did my 8 chemotherapy sessions. After that, I still had to go for a year. To make sure that I was getting the Herceptin and Perjeta. Those were honestly a piece of cake compared to the rest of chemotherapy treatment. I decided for me, because I did not want to be dealing with constant biopsies and things like that. I had a choice of either getting a lumpectomy, which is where they just remove the area where they found the cancer and maybe some lymph nodes if it's there, or you can get a single mastectomy for the breast that had the cancer. I did not want to deal with this anymore. And so I chose a double mastectomy. It's not the best choice for everybody. It's a very, very hard surgery to recover from. There's a lot involved in the recovery because we don't realize how much of our thoracic muscles we use in day-to-day life and how connected like your chest area is to like raising your arms. So I had to relearn to raise my arms. I had to do physical therapy. The days after a mastectomy are miserable. You are not supposed to lie down on the bed because again, you're using so much of your chest muscles to even lift yourself from the bed to get up and all that. It is very humbling to have somebody else wipe your butt, honestly. So I think with the information that I had at the time and knowing my anxieties, I would still choose a mastectomy to this day. For many people, that's like, it's very invasive. It's the most invasive type of surgery that you can have for breast cancer.
And it's a personal choice, right? Like for my mom, she chose not to do chemotherapy because she was like, I'm not going to put my body through that. She chose to do radiation and now she's on some sort of pill for the next 5 years.
Right. Is
And
it tamoxifen?
I think so. I'm not
Yeah.
too sure of the name, but it's something that it's long term and that has given her a lot of side effects that she's continuing to deal with. I just appreciate you so much for even going into as much depth as you did because, just getting that diagnosis, like, that's just the beginning. This is like years and years long. Are you in remission now?
No,
Oh,
I'm not in remission yet. So a lot of people think that we're done with cancer kind of like after the surgeries or after chemo. Cancer is a 5 to 10 year fucking journey of so many challenges, and it's life changing to the fucking core. Like from cancer, I deal with body dysmorphia because even though I have to say that the plastic surgeon that I had was amazing, he did a great job. My breasts look beautiful considering.
what they've been through.
Right. And let me tell you something that is very offensive to a breast cancer patient that we do here. And again, I know some people may not be malintentioned to say this, but please do not ever tell a breast cancer patient that she gets a free boob job because it kind of is like tossed around a lot. I never wanted a boob job in my life. I was okay with my breasts how they were. They were beautiful for me, but they weren't what you would consider like I wasn't a busty woman. My doctor actually told me that that they were different. And for most women, I think that's the norm. Is kind of like one breast is
My left is bigger than my right. I know that.
right. Where there's like lopsidedness
Yes,
in breast.
absolutely.
So I didn't take offense to him telling me that, but what I do take offense to is like people would say like, "Oh, you get a free boob job." I'm like, "The fuck I do? I didn't choose
That's just so ignorant. And if you've said that before, you can go fuck yourself because
it."
come on.
Right, because none of this is a fucking cakewalk. It's really, really hard. And then even to choose to have a reconstruction with breast implants, I cried for a month because you are choosing to put something in your body that, like, right at the time where I had to make this decision, here comes the fucking media releasing the studies from the FDA that there were certain breast implants that were giving women a different type of disease. And I'm like, for fuck's sake, we're trying to fix one problem, not gain like 5 or 10 more. And I'm not saying that everybody that gets breast implants is going to get this disease, but it's a risk.
It's a
And
possibility. Yeah.
right now, for all the women that decide to remain flat after going through this, let me tell you that those women are so fucking hardcore, and I admire them a million times over because as a woman to decide to go flat, like unfortunately the standards of beauty in our society are that we have to look a certain way,
Yep.
right? And it's a very hard decision for a woman to have to come to terms with the fact that she's not going to look that way. And as much as we want to sit here and talk all this bullshit about what counts as what's inside, we know that that's the truth because there's many of beautiful people that are not so beautiful on the inside, right?
Mhm.
But that's not what
Focuses on.
society focuses on the exterior and what people look like, right? And so it's very hard. And I feel like there's a lot of judgment sometimes too when women have to decide to go either way. There's judgment for the women that decide to stay flat, and there's a lot of judgment for those of us that decide to get breast implants. And it's not fucking fair. Like, honestly, I don't really pay attention to it anymore,
Right.
but
And I'm glad that you're bringing that part up. What I think is beautiful is when the survivors who do get the double mastectomies, I see that sometimes they go get tattoos to cover the scars. And,
mhm.
I had a tattoo artist that he actually did one for a double mastectomy patient. And it was just like this beautiful ray of like flowers. And like, it was so powerful just to see that. So it's an individual journey. And I just appreciate you talking about all these different aspects when it comes to being a survivor of any type of cancer, really.
Like I was saying before, there's so much to cancer. The journey does not end when you have your surgeries. And so after the last reconstruction, I think things are going well. Life gets in the way of things. My ex and I end up splitting up. It was really hard to go through cancer treatment with him. He tried to do the best that he could with the way his personality was, but wasn't the best for me. And I think that's as much as I'm comfortable talking about him. But so the statistic for people going through divorces and breakups after cancer is sky high for most women, to be honest. If the men want to come at me for that, go look at the statistics because it is what it is. There's psychologists that are involved in your cancer treatment, not just for you, for your partner, because cancer, it's really hard on the person living it and on the people that are surrounding the cancer patient. I'm not going to use my cancer as an excuse for this person, but that's also a factor of cancer, is the fact that so many relationships just do not survive cancer. So after that, about a year and a half, so now we're in the pandemic. In the pandemic, I'm like, travel for me, a lot of people see travel as an escape. I see travel as an opportunity to get to know myself better, as an opportunity to grow as a person, as an opportunity to reflect on my life, my decisions, because I feel like sometimes in day-to-day life, we don't give ourselves time to sit back and kind of like analyze things. And I am an avid solo traveler, so I feel like those are the best times to assess so many things and kind of like take a different spin on life. And I don't know, just it gave me a lot of opportunity to analyze how I want my life moving forward. So anyway, I go on what I had titled my Cancer Victory Tour. It lasted a month because it's February into March 2020, and we know what happened, right? So I had to come home. Then we get into the routine of things with the pandemic. There was no routine, but it was just insanity. And I'm still going through my treatments with my doctor, like seeing them every so often. And because after you do your surgeries and chemo, you still have to see your doctor every 3 months. Sometimes it's once a month at the beginning, then every 3 months, then 4, then 6, so on and so forth. So at that point, I'm seeing her every 3 months. Then March 2021, I decide to go visit a friend in DC for a month. And I start having pain, but I had had that pain before because I had another cancer. My first cancer scare was at 10 years old. My doctors found tumors in my mouth and I had to have this huge surgery. It was very impactful as a kid to have like 250 stitches in your mouth. Luckily, those tumors were benign. Then at 15, I find out I have another tumor on my ovary. And this tumor was also benign. So I was very young when I started dealing with these things. Those are things that you don't realize that those were potential instances of cancer. Luckily, they were benign. So I find out that I had another tumor in 2021 on my left ovary. And the doctor at that point says, give it 6 weeks and then go and get another CAT scan with contrast. So I do that. And lo and behold, the tumor is the size of a cell phone. Here I am. It's a year and a half after all of this other bullshit that I went through with breast cancer. And I am contemplating another fucking cancer potentially. The doctor, my oncologist, sends me an emergency appointment with a gynecologist oncologist. And this doctor reads everything and they do all kinds of testing. And he says, I can't even biopsy this because this is so large that if we biopsy it and it bursts and it's cancer, we might spread it all over your body. So at that point, I have to make another hard decision in my life, which is to choose to have a complete hysterectomy. I ended up choosing a complete hysterectomy. So in the span of 4 years, I've gone through at least 6 or 7 surgeries at this point. Like I said, cancer treatment is a long journey. For some people, it's a lot less, and it might be, depending on how early they catch it. But one of the things with cancer in general, but with breast cancer, is that even if you're diagnosed stage 0, there's a 35% chance that even if you treated it, your cancer can come back. Another thing here, if you're ever going to donate in October for a breast cancer campaign, unless you're donating directly to a hospital that has mammogram mobiles or things that you can see where this money is going, please don't donate to, I'm not going to mention the
We know
charities,
which one. We know the really big one.
those big ones, because go look at their charity reports and see what their CEOs make, what
Yeah.
their overhead is. A lot of the money does not go to what it fucking needs to go to. And it's such a great marketing ploy to get people to donate money for breast cancer. Also, there's 400 other cancers that are not even getting coverage or donations for their research. So if anybody wants to know what charity I would recommend donating to, they can always hit me up on social media. And
Yeah.
we'll talk about where they.
And we can definitely leave some resources in the episode show notes So I just want to say thank you so much for sharing all of that. I know it was a lot. I'm so proud of you for like going as deep as you did because like I said, it's definitely not easy, but I really just appreciate the vulnerability and the transparency because this is such an important topic that a lot of people struggle in silence through. And it's been very heavy, so I kind of want to like switch to a little bit more like positive and feel good because I don't want to just leave people feeling that way, right?
Right.
So, in this whole process, you started your blogging, vlogging, whatever it is that you want to call it, the Queen of Trips. And I would love for you to talk about how has that been healing for you as being a survivor of cancer?
So, as I mentioned earlier, I've always been passionate about travel. As a child, something I would love to do was go to the library and like find all of these Nat Geo magazines. And I would just like pretend that I was going on these expeditions like all over the world and just seeing other cultures, meeting other people, like just traveling the world. But as the child of a Latino household, those things seem so unattainable to you. So throughout my entire life, I thought of ways to position myself where I would have a lot of access to travel, whether it was through work or somehow kind of learning how people travel so much. And I have always felt that travel has been a healing factor for many things, not just cancer. If I was having a breakup, I would always plan a trip after a breakup. At that time, I wasn't traveling solo, like, I would either plan it with friends or I would go visit family, but I felt like it was always such a good thing to change the energy, change the where I was at, challenge myself a little bit to learn something new about a new place. So travel will never replace therapy, but it is such a good package, like something so good to include in your healing package, as I call it, because it just gives you something to look forward to. And the planning process, I find it to be fun. Some people hate it, but there's resources for that. I find that there's a lot of solace in travel. And please don't take this as escapism. Again, it does help. It does help change like your surroundings and all that. So,
And I love that, you know, as someone that you said earlier, you thought you weren't going to be living anymore. I'm sure for you, like, it's an opportunity for you to go out there and see the world because there is a possibility for everyone, you know, whether you're a survivor or not. Like, we're not going to be living forever. So, you definitely want to try and live your life to your highest potential and traveling the world to see places. I be seeing you on the stories, girl. I'm like, yes, I'm living
oh,
vicariously through her. But I
and
love that.
I've actually paused sharing because I'm focusing on creating a blog right now, and so social media is on hold right now. But here's the thing, and please, for any of your listeners, these words are going to sound negative, but I'm not saying this to be negative. Nobody survives this life. In the history of humanity, there's nobody here that has been here for 10,000 years or 20,000 years or however long you think humanity's been here. We don't survive this life, and we only get this chance to make it as fun, as entertaining, as pleasurable, as whatever you want to call it, as possible. And if we just stick to like, there's so much bullshit that I've had to go through in my life that we barely scratched the surface. And one of the things that I want to portray in my brand and with my persona, and this is who I am like day to day, is you know what? I may not be here next week, but I sure am going to have a good fucking time. And I don't mean being reckless with your life. I'm not talking about like drinking to you lose consciousness. I'm not talking about unhealthy activities. If you want to drink, I don't judge anybody. I myself enjoy a drink or two, but I'm not talking about extreme. I'm talking about like, don't let fear again stop yourself from traveling solo if that's what you want to do. Don't let it stop you from seeking new opportunities in your employment. Don't let it stop you from starting a business. Don't let it stop you from seeking a relationship with somebody that you may be like kind of like holding yourself back from seeking a relationship with somebody. It doesn't just have to be a love relationship. Sometimes we're looking for mentors and we don't even know how to approach somebody. So none of us are going to survive this life. Some of us will not be here sooner than others. But the biggest takeaway is to do what you want to do as long as it doesn't harm anybody else or yourself.
Period. just living your best fucking life, right? I
Right.
think that's just the most important thing, and embracing the in between, because there's highs and lows when it comes to this thing called life, right? But I love that you are not allowing the darkness that you've endured, besides what you've already gone through and shared, to not let it hold you hostage and not live the best life that you possibly could. And I really think that's what I want people to take away from listening to your episode, that cancer is not a death sentence.
Absolutely, right. For family members of the people going through cancer treatment, this is your time to show this person how much you love them. Like sometimes people will ask, "What can I do for you?" Do not put that burden of what people can do for you on the patient. You can see if you're close enough to somebody that's going through cancer, they may need somebody to go to the grocery store for them. I cannot tell you how immensely that helps. If they don't have a list to give you, go and help them make the list. Just dedicating time, maybe setting up a schedule to clean up this person's house. Oh my God, that is something less to worry about. Maybe you go on rotation to cook foods that can help this person through chemotherapy treatment, because honestly, you feel like you got rolled over by an 18-wheeler. There's no, I'm going to get up and cook for people and for women, all of these tasks typically fall on us. Some men also take care of these tasks, but for the most part, it's women. So any support of that type that a family member can give a cancer patient, taking them to appointments, just little things like that. Sometimes people love to give us things like coloring books and things like that. Don't waste your money, honestly. The best thing you can do is listen when a cancer patient is telling you something. Sometimes we don't need you to find a solution. We just need somebody to vent to. And it's really hard to go through cancer treatment, and not very many people can relate because you're not the patient. And again, it's life, mind, body altering. So
Yeah. I appreciate you sharing that. Thinking back to my mom's experience, what helped her the most was just knowing that she had people that she could count on to be there, right? To just talk to just vent to cry to. You feel like you're so alone. I'm sure you felt like you were so alone. And my mom definitely did too, because like I said earlier, she was the first person in our family to have that diagnosis of breast cancer. But just to know that you're there to support, you're there to listen. And even if you just want to sit in the same room and not say anything, but just know that like someone is there and they care, I think that's really important. So I'm glad that you shared that. I want to ask you, being a survivor, what would you tell someone who was recently diagnosed with any kind of cancer? What do you think they need to focus on the most to navigate that journey?
So the first thing I would tell them is give themselves a lot of grace. One of the things that we also don't talk about after cancer is the impact that it has on your mental health. And you tend to blame yourself. And it's so fucked up. To this day, so I'm 4 years into this journey, and I still think back and I'm like, I wonder what the fuck I did to ever deserve this. Nobody deserves this. And there's nothing that you did that you would deserve this ever. Nobody ever deserves this. Not the children going through it, not somebody that's older going through it. So to give yourself like a space to feel the immense amount of feelings that you're going to feel. And then to kind of take it day by day. For some people, the news is unfortunate and they do get diagnosed with terminal cancers. But even terminal cancers, there's treatment, there's so many possibilities. So I would also recommend talking to a therapist. Honestly, like having a therapist on my side has been so amazing. I didn't do it during chemotherapy, but I started to like in my second year of treatment. I started talking to a therapist, and having a therapist, it's an investment, obviously, because it takes time and money. And if it's part of your cancer hospital or your like cancer center's doctors, like book yourself those appointments, because they will really help you navigate the feelings, the emotions. There's so many things. And on top of it, another thing that's, we barely even touched it here. We kind of touched, but the financial fucking struggle of cancer. So after cancer diagnosis, the possibility is high that you become bankrupt in the United States, which is so fucked up. So the more that your hospital has the staff, like a social worker, a therapist, a financial advisor, because they have financial advisors there to help you navigate the finances of this fucking insanity. Use those resources, honestly. Use as many resources as you can. from the hospital because they do help. That's their job.
I appreciate that so much. And I'm not a cancer survivor, but I am a survivor of domestic violence. And I think what was very helpful for me in navigating healing from that journey is to find community as well. And I'm sure there's a huge community of survivors online of cancer, whether it's breast cancer or ovarian cancer or whatever kind, like the power of community can be so healing as well. So I think it's really important, especially as a survivor, because you can tend to isolate, you can tend to like want to take on this burden by yourself, and that's only a detriment to your health, physical, mental, spiritual, emotional, all of those things. So I think it's really important as well, on top of everything that you shared, to find that community.
Mhm. I actually started my Instagram handle. It was a different name. It used to be called Travel Journal of a Cancer Fighter. It's a long name. And eventually I wanted to step away from, like, for a while, I felt like cancer was identifying me. I kind of wanted to step away from that, but I don't want to step away from it completely. Cancer does not define me. However, I do not ever want to stop talking about it because it's so taboo. And
Mhm.
I feel like for older generations, I can understand the way our parents were raised, they didn't talk a lot about so many things. And I feel like it's okay for us to normalize a lot of these things. Like, let's talk about cancer. Let's talk about death. It's not a comfortable subject. Again, nobody makes it out of this life alive.
No one is exempt from it. Yeah.
Right. So we need to talk about these topics so that we can prepare better for them. Otherwise, like, how are we going to help the generations that come
We're
after
not.
us? And
We're just going to continue the cycle of trauma, right? And I just appreciate this conversation so much. It's been so informative. It's been so eye opening. And again, I just want to give you your flowers. I do want to ask you the one question that I ask everyone before we wrap up. So, you're on the Watch Us Thrive podcast. So, tell me, what does thriving mean to you?
oh, so thriving means growing as a person to where I can reach my full potential. For me, that growth process has been, like I said, seeking therapy, reading self help books, going on my solo trips, talking to other women going through similar issues. And they may not be cancer survivors, but when you survive domestic violence and so many other things that are traumatic, childhood sexual abuse, things like that, you've survived something that is so traumatic that there is common thread in survivorship. I feel like thriving is growing into the full potential of what as survivors can be. It's not just we survived this and we're stuck there forever. No, no, we fucking did not survive all that shit for nothing. We survived it to help other people survive that shit too, to help us maybe hopefully prevent people from having to go through that shit, and for those that are currently going through it, to help them out of it.
Hmm.
So I think that's what thriving
That
is.
is so powerful. And I think that's the perfect way to end this conversation. I just want to commend you so much. Thank you so much for coming on to talk about this. I know people are going to want to know more about you and follow you. And I would love for you to be a resource for other survivors out there. So if you could please drop your Instagram and if you have a website, anything like that, that we can follow along your journey.
Thank you so much. So the website will launch next month and it is the Queen of Trips. The Instagram handle is the Queen of Trips right now. Like I said, there's not much on social media. It's not very active right now because I'm focusing on writing for women that want to start traveling solo. And I'm trying to share like a guide of how women can start on that journey.
I'm going to need that because I'm taking my very first solo trip this September for my 35th birthday.
Oh, that's awesome.
Yes.
Congratulations.
Thank
Where are
you.
you
I'm
going?
going to Mexico.
Oh,
Yes.
exciting. I love it. Oh my God, you're so cute in Mexico.
Yes.
And so the last takeaway from this conversation is that no matter if you go through traumatic experiences, always realize that there's always another day and there's hope and to not lose it. Things can get really dark very fast for many people. And one of the things that you have to continue to tell yourself is that you are going to do everything in your power to get out of whatever situation it is. And sometimes there's things that are out of control, like in the situation of a cancer, right? You have to do what you can do with what you have and to never lose hope on life getting better.
Hmm. I love that so much. Maribel, you are such an inspiration. Thank you so much for coming on here. And I can't wait for people to follow you and learn more about you and for you to be a resource for others to know that there is hope regardless of what you've gone through.
My DMs are always open
Yes.
for anybody that doesn't feel comfortable speaking in public, or they may be going through a cancer diagnosis. For some people, they still don't feel comfortable sharing it. But my DMs are always open for cancer patients, especially, or people that just need to quickly chat about, maybe they have a question, they don't feel comfortable asking it out in the open. They're more than welcome in my DMs. So slide through.
Yes. I will link her in the show notes. Absolutely.
And I appreciate you so much, Leanne. Thank you.